In this video, let's talk about how you can actually relieve your hip flexor pain. Hi, welcome back. This is Wei, your exercise physiologist, here to help you better understand your body so that you can improve in your health, fitness and performance. If you don't miss any videos that I post over here, don't forget to click on the subscribe button. Don't forget to hit the bell notification, because this way YouTube will notify you when I post a new video. And in this video, let's cover a little bit about what you don't know about hip flexors. If you haven't watched my previous video, please go and watch them here. And a lot of times people suffer from hip pain, and there are many reasons. If you don't know whether that specific area that's causing you the hip pain, it's really very hard for you to tell and to know what you're supposed to do. This specific ones, we're talking about your hip flexors, and it's very targeted, so it may not help you if your pain belongs to somewhere else. Okay, so let's not waste time. Let's just dive straight into what you're supposed to do, and that can actually help you with the relief. So what you want to do is basically, if you haven't watched my previous video, you want to locate the muscle that's giving you the problem. And first thing, you want to find the hip bone, and from the hip bone, the upwards of it is usually where people get their hip flexor pain, and you want to release this guy. If your thumb is not strong enough, you may end up injuring your thumb. So if you feel like you're using a lot of pressure with one thumb and it doesn't help you, what you can do is you can actually use the other one to come in and to support. Remember, when you are relieving the muscle, don't cause pain. It is supposed to be bearable, and you're not trying to create more pain for yourself. Okay, you should feel the relief after about 15 to 20 seconds. Go slow, go light first. Okay, any pressure that you put on your muscles helps it to release. Okay, so you have to control the pressure. It's really hard for you for me to tell you how hard you're actually trying to push. Okay, so that number one spot is actually from your hip and up. This is where you want to be. Okay, the second spot that you want to be is basically the downside of this hip bone. Okay, and there are actually toe muscles over here. If you roll around, you will feel one that is just really below the hip bone. Okay, that belongs to your rectus femoris, part of your quads muscle. Okay, and the other one, basically, if you were to move, maybe, well, everybody's width size is a little bit different, but you realize that when you move inwards in this direction from the hip bone, this is your second spot, right? You can release this. Then the third one is basically just in here. Okay, so you want to find what after this hip bone, where else is actually giving you this problem. This is most probably going to be your sartorius muscle. You want to find whether it is giving you the problem. Okay, this muscle can run into your knee and diagonal in that manner. So you will usually feel some soreness around this area, because it kind of become like a supporting role over here, and you want to be able to release this muscle as well if you are getting into trouble with your hip flexor. So what you want to do over here is that you also want to learn how to stretch these muscles. So this is the position that you want to get to. So basically you're trying to take quite a big step forward such that your toes are pointing forward.
and your heels are actually lifting off. So one thing to take note is that you don't want to be leaning forward, and you also don't want to be leaning backwards. You want to keep your body vertical as much as you can. The other thing to take note of is that you don't want to arch your body. This way, it's not going to help you as well. Okay, so for some people, if they can't feel the stretch, what I suggest is that once you get into this position, you may want to wiggle your legs backwards a little bit. This will help you.
There you go. What you want to do is to be good at locating the muscle, because if you're on the wrong muscle, whatever pressure or whatever force that you're trying to apply to may cause harm to a different muscle, and that doesn't help you. So if there's no sore and there's no achiness and there's no pain around the area, you probably don't have to work on the muscle, and you just have to give a skip, and it's okay to not put too much pressure on it as well. Okay, so that's really all I want to cover in this video, and in my next video we're gonna talk about hip impingement, and that's where we talk about what's causing the hip pain that is deep inside. Alright, so if you haven't clicked on the subscription button or the bell notification button, please do so, because this way you'll be notified by YouTube and they will let you know when I post a video. And if you like this video, don't forget to give me a thumbs up, because this way YouTube will also share this video with people who are looking for something similar like you, and it will share it with them based on the algorithm. Okay, and if you have any questions, don't forget to post it on the comment section below, and I will try to answer them as much as I can. And if you have any things related to other joints, same thing, you can also post it here. I will be able to read them and I will get back. And if there's a need for other videos, I will also create them so that more people can understand what's happening over there. Right, so that's it for this video. Please take care, and I will see you soon.